Hello class, are you with me? So let's continue. So intrauterine insemination is the injection of washed prepared sperms into the uterine cavity through a fine catheter. I guess you saw it in the video, so that we can skip it. We saw it in the video, or I should still go through? Okay, so it's the injection of washed prepared sperms into the uterine cavity through a fine catheter. So you use a catheter here. This is what he is holding. So you use it to insert or inseminate or push the sperms into the uterus, so that it will bypass the cervical mucus plug, bypass the acidity of the vagina, because vaginal acidity can kill the sperms. So that it will bring the sperms closer to the ovaries, so that there will be what? Fertilization in the ampler region of the fallopian tube. So it's injection of washed prepared sperms. You take it from the husband or from a donor. If the husband is azoospermia, is not producing sperm, you go and borrow from a sperm bank, or somebody donate for you and give him money. So injection of washed prepared sperms into the uterine cavity through a fine catheter during the ovulation period in a natural or stimulated cycle. So the woman can have a natural cycle, or if the woman is also having problems with ovulation, then you stimulate the woman's ovarian cycle with the drugs that are enumerated over here, these drugs. Okay, so let's continue. So although pregnancy may not occur as quickly, a policy of initial treatment by IUI will probably save 20% of couples from moving onto IVF. You know, the reason why we prefer you to, if you see that if the woman and the man are infertile, the first step is that if the woman is having oligospermia, then you can just go to Dr. Razak's place and he can just do IUI for you. IUI is not expensive. As of the year 2017, they can take you 10,000. But IVF is now around 60,000. So you can see, no, IUI was even around 1,000 CD or so, 2017. But now you can get to 10,000 or 5,000. But IVF is about 60,000. And the chances of survival or chances of becoming pregnant is only 20% for the IUI. So after 3 to 4 cycles of failed IUI treatment, patients should consider opting for in vitro fertilization, because IUI, you are just supposed to carry the sperms into the woman's ovary, closer to the woman's ovary, so that there will be fertilization, so that it will bypass the cervical mucus plug and bypass the acidity of the vagina. But with the IVF, you make sure you trigger or stimulate the ovaries to produce egg, and you harvest this egg, go and put it in a petri dish, and harvest the man's sperm also, and cause them to fertilize outside a human host. So the IUI procedure is here. The procedure may help in increasing the chances of pregnancy in the following ways. It allows sperm-ovum contact close to date and time of ovulation, by bringing the sperm very close to the site of fertilization and bypassing the cervical factors, the mucus plug and the acidity of the vagina. Sperm preparation increases the sperm density and removes all antigens. So the sperm, you know, those sperm counts and those things, you have to make sure you prepare the sperm, do the necessary dilutions, so that it will increase the concentration of the sperm, and also removes all antigens on the surface of the sperm that will cause it not to be able to move or swim faster to the woman's fallopian tube. IUI is the simplest and the least expensive method of ART, as I told you. And IUI alone, which is natural, does not improve pregnancy chances. Hence, mild ovarian stimulation is usually recommended. So with IUI, you need to also stimulate the ovaries to produce egg. But some of the ovaries, if you say you will wait for ovulation period, some of the women, they will never produce the egg. Some of them have irregular menses and other things. So you don't depend on them. So you need to stimulate with clomiphene and the rest. So indications for intrauterine insemination. The only time you can do intrauterine insemination is at least one fallopian tube must be working, and also there should be a hole or patency so that the sperm can flow through the fallopian tube. The male also should have a mild male infertility. When we say mild male infertility, it means that the male should have what? It should have oligospermia with normal hormonal levels. And the hormonal levels of the male you'll be looking at is, and the hormonal levels you'll be looking at is the FSH, LH, and testosterone. The male should have this for IVF to be able to be successful. For IUI to be able to be successful. So the male should have IUI self, the male even is supposed to even have oligospermia, so that you just harvest the sperm and put it there. Or the male should even be normospermia if the woman is having a problem. So mild endometriosis. So the woman has the endometrial tissue has moved towards somewhere, hiding somewhere. These are the indications for IUI. Coital problems. Some of the women, if you want to sleep with them, you suffer. Some of them, if you are sleeping with them, you are having sex with them, they will be bleeding from the vagina. Some of them, if you touch them small, they have vaginal dryness and they are having pains. So just inject the sperm through a catheter into her fallopian tube and she will become pregnant. We have immunological factors such as rhesus isoimmunization, and this is also called erythroblastosis. It's also called hemolytic disease of the newborn, or erythroblastosis fetalis. So those problems can all indicate. We have HIV. If somebody has HIV, you don't expect that the person will have unprotected sex to be able to impregnate the wife or something. So we can just harvest the sperm alone and go and put in the fallopian tube for her to become pregnant. Even as they are living, then the man can be wearing condoms so that they will enjoy themselves. But if they need children, yes.
Some students are trying to join, but they said they are not letting them.
Let them in. Sorry.
Sir.
Yes.
I want to ask a question.
You wait. The things I have to go into. You ask, but let me do something small. So immunological factors, erythroblastosis fetalis. That's why we do the Coombs test and others to see whether if the woman, you're having an Rh positive child, Rh positive child, and the woman is Rh negative. There's Rh isoimmunization. There will be reaction between the fetus and the mother. The mother will produce antibodies against the fetus, and that is the immunological factor. So instead of you to go and buy anti-D, you can just do intrauterine insemination, so that you bypass some of these problems. Immunological factors over here can be Rh, erythroblastosis fetalis, whatever, but I don't think that is it. But the HIV, you need to escape the raw sex, because if your husband is having HIV, you want him to give you HIV. No. So you harvest the sperm and put it closer to the fallopian tube so that the woman will become pregnant. But maybe some of these situations, when you are harvesting the sperm to send there, you have to maybe give the woman antiretroviral prophylactic drugs, so that in case there is some there is some virus, HIV virus in the sperm, it will cater for it. We have donor sperms, we have cervical factors, polycystic ovarian syndrome. Some of the women, their ovarian reserve is so low due to genetic factors, the ovaries are not matured well, and that is what we call polycystic ovarian. With polycystic ovarian syndromes, we have a lot of ovaries, a lot of ovarian follicles, but they are immatured, so they cannot produce the ovum or the egg for the woman to be able to conceive. Unexplained infertility or idiopathic infertility, then ovulatory dysfunction. So let's go to the next slide. So indications for donor sperm IUI. So if you want somebody to come and donate sperm so that it will fertilize your womb, we can put the sperm inside the uterus so that your woman can be pregnant. Then you yourself, you should not be able, you should have absence of what? Sperms. That's azoospermia. Severely subnormal semen parameters. So your rapid with linear progression, the activity of the sperm, morphology of the sperm, they are all supposed to be very, very low. Persistent failure of ICSI, intracytoplasmic injection, and the rest. Then Rh isoimmunization, that's erythroblastosis fetalis, hereditary disease in the male partners. So if this man has a lot of problems like this, the man has done intracytoplasmic sperm injection and he has failed. The man attempted, made the woman pregnant, but there is erythroblastosis fetalis, hemolytic disease of the newborn. Then also hereditary disease in the male that cannot be explained. Severely subnormal semen parameters. No sperm at all even in the semen. Then you have to go and beg somebody. Maybe your brother. That brother, come and help me. Give me sperms to impregnate my wife. And your brother will just tell you that let me just sleep with him for one night. You say, no, I will not allow you to sleep with my wife whilst I'm around. Am I an Eskimo? No, Eskimos do that. I don't do that. So we just go to the embryology lab in a hospital or a fertility center. We'll do semen analysis, take your sperm, then we'll put it in my wife's uterus so that she will become pregnant for me. But you have to sign some court forms. The court has to, you have to sign some consent forms so that the court will clear you in case the donor comes back and say, hey, I'm demanding this. You say the law says that this and this. Let's proceed. So indication for ART, that's IUI or IVF. The indications for IUI are often not dissimilar to those for IVF. So the indications are similar for all of them and they overlap. So these are some of the indications, common indications for IUI. Unexplained infertility, endometriosis, male factor infertility, ovulatory disorders, inability to have vaginal intercourse, people with conditions that require specific consideration, such as a man with HIV positive. Because if a man is having HIV, the sperm will definitely carry HIV virus. But if the woman is having HIV, it's very difficult for the man to contract the HIV through sex. We have a lot of men like that. They've been with their wife, they've given birth to about 5 children. For about 5 years, 10 years, they stay together, but the woman is having HIV, the man does not have. Because the man has a small, the urethra orifice. The urethra orifice. The urethra orifice of the man is very small. When we say orifice, is the hole, So the urethra orifice of the man is very small, so it makes the vaginal juice entering it is not significant. So let's look at some of the indications. So we have people so we say inability to have vaginal intercourse. People with conditions such as HIV, positive for the man. People in same-sex relationship. So if you are in same-sex relationship, you are a woman who has married a woman, then you have to go for another man to give you sperm. Then you put it in your supposedly wife. Two women who have married. So they require donor sperm. Okay, indications for IVF: unexplained infertility or idiopathic infertility, endometriosis, that's severe to moderate to severe, male factor infertility, moderate to severe, ovulatory disorders, if the woman is not ovulating or producing eggs, tubal pathology, if the tubes, the salpinx or fallopian tubes are inflamed or they have a problem or is blocked, donor oocytes. So with those ones, then you have to go for, if the fallopian tubes are blocked, then you have to go in for, Vida, please, I'm having an online lecture with my phone. I will call you. So if the donor tubes are blocked, if the woman's tubes are blocked, then you need to go for a donor egg. Then genetic surrogacy. Some of the time you can also go for a woman, you go and beg a woman that, oh, my husband is having normal sperm count, but me, I have incompetent uterus. My fallopian tubes are destroyed. So my husband will take your egg, fertilize it outside, and put it inside you because you have a competent uterus. So most of the time in America and other places, and even in Ghana, they use prostitutes. Then the prostitute will deliver and give her. Then you buy her a car or give her a mansion or anything at all, but it has to be guided by law. Then that is surrogacy. Then possibility of genetically transmitted diseases and fertility preservation in cancer patients. So if somebody also have cancer, a woman has cancer, then what happens over here is that they will need to preserve the woman's the embryo, like when they fertilize outside the uterus, they will have a lot of embryos, which they will bring 3 or 4 of them and come and put them in the uterus. But this person is having cancer, so you need to keep all the embryos, so that anytime she wants to deliver, you will give her the embryos to deliver. So that is what we call fertility preservation in cancer patients. So let's also look at basic requirements for IUI success. So we look at patient selection. Age of the female partner should not be more than 35 years. Because from 35 going, you are becoming menopausal, and ovulation will become a problem. Your womb will become second-hand womb. Duration of infertility should not be more than 5 years. You are 10 years duration of infertility. You cannot be successful with IUI. You've married for about 15 years and you are infertile. You cannot produce by IUI. It will fail. Cause of infertility: at least one functional normal fallopian tube and no uterine factors. This one will qualify you. Then adequate ovarian reserve. So the woman, when we say ovarian reserve, it is the number of potential eggs a woman has left. So every woman has a number of eggs that God gave her. So if you utilize your egg every time, you alone, every time abortion, tomorrow abortion, the next day abortion, everybody has ovarian reserve. Somebody has 200 ovaries in the follicles. Another person has only 10 ovaries. Another person has 1,000. And when you menstruate, they leave one in the menses. So if by God's grace you become pregnant and you say, oh, I don't love the man, I don't love him, When you were sleeping with him, did you know whether you loved him or you didn't love him? So you have an ovarian reserve. So if you don't preserve your ovaries and you lose them, you become infertile. You need to go and borrow, go for a donor egg, and they will charge you. So the cause of infertility, at least one functional normal fallopian tube and no uterine factors. Adequate ovarian reserve. So when you have adequate ovarian reserve, you can use serum anti-Mullerian hormone to measure the ovarian reserve. It's a marker that we use to determine whether your ovaries you have sufficient number of ovaries or ovarian reserve. So we have intrafollicular count. That one is you use ultrasonography to count the number of follicles inside your ovaries. Then we have day 2, FSH, LH, and estrogen levels. This is for the woman. Semen parameters for the man also. So the man also is supposed to have semen parameters. And the semen parameter, the TMSC, represent total motor sperm count. Total motor sperm count. So it means what? Total TMSC is what? Total motor sperm count. So the man should have normal, or total motor sperm count should be normal for the man. So it should be greater than 5 million per milliliter of what? The sperm. So for best pregnancy chances, it's supposed to be greater than 10 million. But if it's less than 1 million or it's 2 million, please don't think about going for IVF, or I don't think about going for IUI. It will fail. So with those serious oligospermia and azoospermia, you go for IVF and ICSI. So basic requirements for IUI continued. Choice of ovarian stimulation, the drug that you use to stimulate the ovaries to produce the egg. Number of dominant follicles. How many follicles do you have? Do you have 1 to 3 follicles or more? The more the follicles you have, the more the chances of what? You releasing your eggs and becoming pregnant. So and conducting IUI. Use of transvaginal ultrasound follicle monitoring. So that's what we use to look for intrafollicular counts. Timing of IUI. So between the IUI, if you want to do it, you make sure that day 14 of the menstrual cycle is where we have the luteinizing hormone surge or the ovulation. So you should gauge the ovulation. You should gauge when you want to insert the sperm inside the uterus. You should gauge between 12 to 16 days, because the ovulation period is at the 14th day. So you should use any of these average days between 12 to 16 days. Interval from HCG injection. So if you want to also inject HCG, human coronal gonadotropin, when you inject it, it causes what? Nourishment of the endometrium. It causes the endometrium to be nourished so that it can support fetal growth. So when you inject the HCG, within 32 to 42 hours, then you do the intrauterine insemination. Then single intrauterine insemination, you just use the 36 hours after that. 36 hours after HCG injection is preferred, because the HCG will cause proliferation of the endometrium to support fetal or the blastocyst. So we have semen preparation techniques. Quality and expertise of lab personnel is also important, because you need to concentrate the semen well so that we can inject it into the uterus to bypass the cervical mucus plug and also vaginal acidity. So if the technician is not qualified, he cannot do the work well. Procedure of IUI and type of catheter use. The type of catheter is also supposed to be a state-of-the-art catheter. Luteal support is recommended. We will get to luteal support, and there are some things that will cause proliferation of the endometrium, and that is what we call luteal support. How many IUI cycles? Okay, so Intrauterine insemination. So you go and read on this. Hello. There is general agreement in the literature that chances of success are better after mild ovarian stimulation and maturation of maximum of 2 or 3 follicles. Yes, I've said this already. However, the cycle must be monitored by ultrasound. So when you are doing this insemination, it has to be ultrasound guided so that you can be seeing freely. When you are inserting the catheter, you can see with your eyes that the catheter has really entered the uterine space. And hormonal analysis. And you should also do hormonal profile to check. If there are more than 3 mature follicles, the attempt should be cancelled. Okay. So while the current use of ovarian stimulation may increase pregnancy rate, it may at the expense of a high chance of multiple pregnancy. So you know, some of these artificial reproductive technology, all of them lead to multiple gestations, multiple pregnancies. So it says that if the follicles are more than 3, then if you have about 10 follicles, then you are going to give birth to about 16 children or 10 children. The triplets and other things that you cannot count. So you should use maximum of not more than 3 follicles. When assessing the duration of IUI program, the age of the woman is very vital, because if you are more than 35 years old, it's become very difficult for your uterus to be able to support the insemination. So it's very difficult. So the hormones have gone down, you are becoming menopause. So it's difficult for you to deliver. So let's look at the first test tube baby. This is BBC News. This is the first test tube baby in 1978. She was born, fertilized outside the uterus in the test tube. So the world's first test tube baby, Louise Brown, she is a woman, has spoken of her joy at giving birth. She has also given birth, but she gave birth naturally. Baby Cameron was born on 20th December 2006 in Bristol, where his 28-year-old mother, this is her mother, Louise Brown, lives with husband Wesley Mullender. You said what? Hello? Hello? So, hello, can you hear me?
Yes, sir.
Okay, so this is Louise Brown, and the first test tube baby, and they grew her outside the uterus in 1978, and she gave birth naturally in 2006 when she was 28-year-old mother. So let's go and look at IVF. Let's look at this short video on IVF so that we will continue the procedure for IVF.
The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct, but that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. The technique of in vitro fertilization, or IVF, removes several eggs from the ovary for fertilization in the laboratory. After a few days, 1 or 2 of these fertilized eggs, which are now known as embryos, are returned to the uterus in the hope that they implant and become a pregnancy. Women having IVF are given special reproductive hormones to encourage several eggs to develop in the ovaries. Final maturation of the egg itself is induced by the administration of a further hormone. 36 hours later, fluid containing the eggs is drawn from the ovary with a needle. This is usually performed under light sedation in a short outpatient procedure, with the doctor using ultrasound to check proceedings. eggs collected from the ovary are then mixed with a sample of the male partner's sperm, which has already been washed and concentrated. The eggs and sperm are left in an incubator set at 37 degrees for 24 hours so that fertilization can take place. During this time, only one of the many sperm cells will penetrate the outer layer of the egg and achieve fertilization. Following fertilization, the cells divide and multiply and form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin, flexible tube, where it is left to implant and form a pregnancy.
It's not showing here as a video, it's just a picture with an audio behind it.
Are you sure? It's not showing as a video.
All these...
No, it's just a picture with an audio behind it.
Oh, okay.
The first one was like that.
The first one was like that. Hello? Hello?
Hi.
Yes.
Hello?
Yes, sir.
You okay?
Yes, that's how it is. Yes.
Okay, so you get, I've recorded it, so you get it clear in the video. Okay, so IVF and embryo transfer. In vitro fertilization and embryo transfer are the basic ART for all related technology. So, intracytoplasmic sperm injection, assisted hatching, pre-implantation genetic diagnosis, cryopreservation. This is when you, after you get the embryo, when you keep them in a fridge, or you lyophilize them and keep them in the fridge, so that anytime the couple come back that they want to give birth again, you can just give them the embryo, put it in the woman's endometrium, and she will become pregnant again. So that is cryopreservation. Keep it in the fridge. Donor oocyte IVF programs, donor embryo. These are all in vitro fertilization techniques. These are all in vitro fertilization techniques. So the various steps of an IVF treatment cycle. First and foremost, what you need to do is to work up the IVF. Look for full blood counts, the hormonal level of the woman and of the man, testicular biopsy. The man, you have to know whether the man is producing sperm, whether the man's testicles are functional, and that is what we call testicular biopsy, to find out whether the testicle is functional. So, but some of the time the man may have azoospermia because the man may have azoospermia due to obstruction in the epididymis or obstruction in the spermatic cord and others. So obstruction can prevent the man from having normal sperm count. So you look for. Who is that? Who is that? Mute your mics. So you look for. You work up the couple and find out the actual causes of the problem. Then you do ovarian. So let's continue. So we do the workup for we find out the problems, the hormonal levels. You do the scan for the woman. We find out the problems, why you should do IVF for them. Then you stimulate the ovaries to release the egg using the drugs, the chloromethine. You use the chloromethine. Then the drugs that I wrote, the chloromethine and serophene and the rest. Then you stimulate the ovaries to produce the egg. Then you monitor the production of the egg. Then when the ovulation is induced, oocyte is transferred or retrieved, and the sperm is also being prepared in the laboratory, embryology lab, by laboratory personnel like you. Then in a petri dish or in a test tube, you do the fertilization. You put the concentrated sperm or semen on the egg, like you will be seeing in the video. Then there will be embryo transfer. Embryo transfer. So after the fertilization, you transfer the embryo into the woman's endometrium and give some drugs and other things, hormones that we call luteal support, so that it will proliferate and produce more red blood cells, more glycogen, fat, and other things to support the implanted embryo. So this is the whole principle about IVF. So let's see. So with IVF, now you harvest the follicle, the egg, you stimulate the egg production. Then after stimulating the egg production, you add the egg, you add the sperm, the semen to the egg in a petri dish or in a test tube. Then these are all ovarian follicles. Ovarian follicles. So this is the procedure for IVF. So the in vitro embryo development. So when you put, so in the test tube, this is what happens. The egg is what is in the middle. Then all these around it are what we call the sperms. The sperms are around it, and the egg is surrounded by the cumulus layer. So now this is the egg. There's one sperm will enter. You remember your zonal peninsula, one sperm will enter, then to prevent polyspermia or other sperms from entering. When one sperm enters, other sperms cannot enter. So we have two nucleus. The pronucleus are two. One is for the egg, one is for the sperm. They will join to produce the 4-cell stage embryo, which will also divide to produce the 8-cell stage. Then the fully grown blastocyst will be produced. The fully grown blastocyst will also be produced. So what's the indication for IVF? IVF as first-line fertility treatment. Tubal pathology, you have to look at the tubes, whether there is a problem with the tubes or not. You have to consider whether you want to go for a donation, egg donation, if you are not able to produce egg even upon stimulation. Genetic surrogacy, go for somebody to come and bring her egg and come and carry your fetus for you. Then possibility of genetically transmitted diseases. Fertility preservation in cancer patients. A woman is having cancer, but she still wants to give birth to preserve her generation. Then we can just take her egg and go and do IVF and come and put it in her womb so that she will deliver. Where ICSI is also indicated. In ICSI, that intracytoplasmic sperm injection, is the most expensive of the in vitro fertilizations, and that one is only done if the man is not able to produce sperm. So if you are not able to produce sperm, what happens is that they will harvest, because you are having obstruction in your you are having a obstructive azoospermia. So your spermatic cord and others, your spermatic cord epididymis will be obstructed. So you are not able to, the sperm is not able to swim there. So they need to stimulate your testis to be able to produce sperm, or your epididymis to be able to produce sperm. Then they put it in the petri dish which contains the egg to harvest. Then they put it back. So with the ICSI, we just need one sperm, not more than one sperm. But with the IVF, we need more than one sperm. So ICSI is a very high quality ART technique, because it leads to, and the fetuses from ICSI, the children given birth by ICSI, they have quality children. They are normal children. But the IVF, you can have a child with one eye, a child with one ear, a child with one leg, even though you are going to pay about 600 million. But the ICSI, you end up paying about 1 billion or 800 million. And that one gives a very good quality children. So IVF following failed cycles of IUI. So if your IUI, intrauterine insemination, fails, then you have to consider going for IVF. So indicators for early referral. Female age. You know, the biological clock is not on the side of the woman. So most of the time, looking at the y-axis and the x-axis, annual fertility rate per 100 women not using contraceptives. So we have, this is the fertility rate, then this is the age. So as a woman age beyond 35 years, you can see that as a woman ages, her fertility will be declining. So if she does IVF and others, if she doesn't do it on time, after 35 years, you will even do IVF and it will still fail. But the doctor will collect the 600 million and go and chop. Woman's age is the initial predictor of her overall chance of success. Live birth rates per embryo transfer by age, according to the Human Fertilization and Embryo Transfer post-October 2007 data. So you can see over here that live births per 100 embryo transfers. So we are having live births that were given. You realize that most of as the woman age, the age is the y-axis, and the live birth is the blue. This is the live birth. So the live birth, and the age is the x-axis. So this is the age axis, and this is the live birth. So you realize that as a woman ages to the year 44, you can see that if she even does IVF and other things, they will not succeed, because the fetuses will die, or the embryo will not. The woman, if you even test her for beta HCG, there will not be any pregnancy, no conception, because she is old. The more you age, your hormones and other things become imbalanced. You become menopausal and others. So diminished ovarian reserve at any age, AMH, that's anti-Müllerian hormone, is what we use to quantify your ovarian reserve, whether you have enough ovarian follicles or eggs to support, or to eggs for a sperm to hatch to become pregnant. Antral follicular count less than or equal to 4, then the 2 FSH level should be greater than 8.9. So the anti-Müllerian hormone of less than or equal to 5.4 means that your ovarian reserve is very, very low, meaning that you will not be ovulating. Your ovulation capacity is low. Antral follicular count less than 4 is very bad, because the follicles is supposed to have, let me show you an example of the follicles. So these are the follicles. So this woman has 1, 2, 3, 4, 5, 6, 7, 8 follicles. And that is what the eggs are produced from. So if your follicle is low, you should know that it's very difficult for you to deliver by IVF or ICSI. Endometriosis, if your endometrial tissue has migrated to the liver or the lungs or anywhere, where will it be to support the fetus? It will be very difficult. Moderate or moderate degree of semen quality abnormalities. So if your husband also has semen quality abnormalities, then there is high likelihood of IVF and ICSI and even IUI failing. Tuber compromise, if your fallopian tubes are not of a good capacity, then you are also going to suffer same. So please, I'm recording this video for you, so I'm just playing it. It's just about 1.5 minutes to 2 minutes. So just listen to it, but it will, when I send you the recording, you will see it clearly. So let's just watch the video.
The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation
Please, off your mic,
and the desire to have children is a similarly natural instinct, but that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. technique of intracytoplasmic sperm injection, or ICSI for short. This is a method which has revolutionized the treatment of male infertility in recent years and gives men with poor quality sperm the chance of fathering their own children. In natural conception, many millions of sperm cells in each ejaculation are necessary for fertilization. In ICSI, just one may be enough. Women having ICSI are given special reproductive hormones to encourage several eggs to develop in the ovaries. The eggs are then removed from the ovary in a short outpatient procedure. Fertilization in ICSI is achieved by injecting an individual sperm cell into each of the collected eggs. For this purpose, each egg is placed under a very powerful microscope, and a single sperm cell is injected directly into it by means of a very fine needle. Following injection, and after about 24 hours in the incubator, most of the eggs will show signs of fertilization, and the cells divide and multiply to form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin flexible needle, where it is left to implant and form a pregnancy.
Okay, so class, we are back. So I guess you can see my slide. Hello? Hello?
We can see, sir.
Okay, so ICSI. So ICSI is intracytoplasmic sperm injection, and it is indicated for men who have azoospermia. When you check their semen, there is not even one sperm inside their semen. So these are the men who will go for the ICSI, and it's the most expensive in vitro fertilization. This is the most expensive, ranges from about 700 million to 1 billion. So you need a child. What you do is that you take only one sperm, because the man is having azoospermia. So they will force the embryologist will force and take and aspirate a sperm from the testis or the epididymis, because the man is having obstructive azoospermia. So if you take a sperm, one sperm, and go and puncture and bring the sperm here, this is the catheter, go and come and puncture, this is the egg with a polar body. So it will come and puncture the cytoplasm of the egg, then it will put the sperm inside the cytoplasm. And this is what we call intracytoplasm. This is the cytoplasm of the egg. So it will put the sperm, one sperm, inside the cytoplasm of one egg. And this one will lead, afterwards you transfer this embryo, because when the sperm is inside the cytoplasm of the egg, you know the cytoplasm of the egg contains the pronucleus, or the nucleus of the egg. So the sperm nucleus will also attach the nucleus of the egg, and it will fertilize, it will become what? The zygote. And the zygote will lead and become the embryo, which will be transferred into the endometrium of the woman for the woman to conceive. So unprecedented successful development of ART, which has revolutionized the management of severe male infertility, is ICSI. The procedure involves the direct injection of a single sperm into the egg cytoplasm. Just a single sperm, because the man is even struggling to produce sperm. He doesn't have even one sperm. So they will force the sperm, they will force and harvest the sperm from the epididymis or from the testis directly. They will use some means to aspirate this one sperm and put it in one egg of the woman. Inject the sperm into the cytoplasm so that there will be fertilization. So the fertilization is direct. This time it's not like in vitro fertilization, which is for oligospermia or normospermia, which a lot of sperms will be swimming to go and fertilize one egg. This one, just one sperm will be assisted by puncturing the cytoplasm to put the sperm inside the cytoplasm of the female, of the woman, or of the egg, to produce so that the nucleus of the egg and the nucleus of the sperm will fuse to become a zygote, and this one will lead toward the production of embryo, which will be stored for later use, or will be implanted in the endometrium of the woman to cause pregnancy. So, indication for ICSI: severe alterations of semen characteristics. History of, so what makes us do ICSI is severe alterations of semen characteristics, history of fertilization failure, and so when you do IVF and it fails, then you go for ICSI. That's the highest standard. So the sperm, the man is having azoospermia, so you need to aspirate, force a sperm to come out of the testes or the epididymis. We just need one sperm. And we have also unknown indications. So success rate for IVF is 24.7%. Hey, so you have paid 500 million and you fall within this success rate, meaning that there is about 66, hey, is it 76 chance of you not being able to conceive after doing IVF, meaning that you have thrown away your money, you have bought car like that. Then there is also 50% of all embryos cultured in vitro reach blastocyst stage by day 6, so they are able to produce the embryo, but whether the embryo will be able to grow in the endometrium to become a fetus is also a problem. We have about 15% of transferred embryos develop into a baby. So 85% of the transferred embryo are likely not to develop into babies. They may die through stillbirth, or they may even fail to produce conception. So basic requirements for IVF and ICSI success: we look out for clinical history, examination, and those ones are what we did in the lecture 5. And why is it necessary? To identify the cause of infertility and thereby prognosis, after you've done the scan of the uterus and other things, to identify and correct associated adverse factors before treating primary disorder, and to decide on the most appropriate drug to use to stimulate ovulation and the starting dose required, to assess reproductive aging, and also plan early access or resort to ART treatment. So if you know you are 37 years old and you haven't become pregnant, you should know whether you should go for ART, that's IVF or ICSI or IUI, because you know when you age, your chances of not being able to become pregnant is very high.